In this session, we're going to be talking about hypertension and coronary artery disease. After completing this lesson, you should be able to essentially design a concept map including the pathophysiology of these disease processes, the clinical manifestations, risk factors, causes, identify nursing diagnoses, medications, nursing interventions, and multidisciplinary team members to help manage the care of patients with these disease processes, as well as utilize evidence-based practice in the care of these patients. Hypertension is defined as a systolic blood pressure greater than 140 millimeters of mercury and or a diastolic blood pressure greater than 90 millimeters of mercury. This means that either one of these have to be above those thresholds. They don't both have to be. So blood pressure can be classified as prehypertensive, and you can see the ranges of 120 to 139, systolically over 80 to 90 diastolically. Stage 1 hypertension with their ranges, and stage 2 hypertension. Hypertension is a major risk factor for coronary artery disease, heart failure, stroke, and renal failure, all of which we will discuss throughout this lesson. So the pathophysiology of blood pressure is essentially that it's a force that is exerted against the walls of the arteries. So this is known as your mean arterial pressure. So we calculate mean arterial pressure, and it's important to know what mean arterial pressure is because essentially when we know what mean arterial pressure is, mean arterial pressure gives us an indication of one's ability to be able to perfuse our viable organs, so our brain, our heart, our lungs, and our kidneys. So we define MAP, mean arterial pressure, as the average pressure in a patient's arteries during one cardiac cycle. And like I said, this helps indicate how well our vital organs are being perfused. Now, in order to calculate MAP, you need to know the systolic blood pressure and the diastolic blood pressure. So the formula for figuring out your patient's MAP is MAP equals systolic blood pressure times 1 plus diastolic blood pressure times 2. Add those two numbers together and divide by 3. So if you have a patient whose blood pressure is 120 over 80, their MAP would be equal to 120 plus 160, because that diastolic blood pressure has to be doubled. So 120 plus 160 is 280, and we divide that by 3. So if you guys want to take your calculators out and do that, so we have a blood pressure of 120 over 80. So if you calculate the mean arterial pressure for that particular patient with that blood pressure, your mean arterial pressure, or your MAP, should be 93.3. If you round that, it would be rounded to 93. So what does this number mean to you? A MAP of at least 60 millimeters of mercury or greater ensures that there is enough blood to flow to those vital organs and keep them perfused. Again, the heart, the brain, and the kidneys. And the doctors usually will consider anything between 70 to 100 millimeters of mercury to be a normal mean arterial pressure. Systolic blood pressure is the blood pressure when it's at its highest pressure at the peak of ventricular contraction. So if you did some of your pre-class activities, the highest pressure at the peak of ventricular contraction. So if we talk about ventricular contraction with respect to left ventricular contraction, that essentially, or even right ventricular contraction, essentially that would be the afterload, the amount of pressure it takes to expel the blood that's in the ventricles. So an average systolic pressure should be less than 120 millimeters of mercury. Diastolic blood pressure, on the other hand, should be the lowest, or it is the lowest pressure exerted during ventricular relaxation. Systolic blood pressure is higher because this is when the heart is working. It's contracting. It's got to work. Diastolic blood pressure is lower because it's relaxed. This is when preload is happening. Refill my ventricles. Let me take in all this blood. So an average diastolic blood pressure should be less than 80. Blood flow. This is the volume of blood that's transported in a vessel, organ, or throughout circulation. These are some terms that you should know in relation to perfusion. Pulse pressure is the difference between the systolic and diastolic pressures that we discussed. Normally, this should be approximately 40 millimeters of mercury. Then we have peripheral vascular resistance. This is determined by three factors: blood viscosity, so how thin or how thick is the blood; the length of the vessel, does the blood need to travel 2 inches or does it need to travel 4 feet; and the diameter of the blood vessel. So the diameter of the blood vessel is extremely important because the thinner the diameter of the blood vessel, the harder that blood has to work to get through that vessel, especially if the blood is of thicker viscosity. Factors that influence arterial blood pressure include the sympathetic nervous system stimulation, our fight or flight response, right? So our fight or flight response, it puts us into like a more alert mode. It increases our heart rate. Therefore, when our heart rate increases, it helps the heart to contract more and to release more blood or perfuse more blood. Circulating epinephrine and norepinephrine hormones, again, this is part of our fight or flight response. So these hormones are going to help us in, influencing arterial blood pressure. Epinephrine has slightly more of an effect on our heart, while norepinephrine has more of an effect on blood vessels. Then we have the renin-angiotensin-aldosterone system, otherwise known as the RAS system. And this system helps to regulate our blood pressure with respect to kidney function. Okay, so this is an important regulator in blood pressure. So again, the RAS system, it is a hormone system. It regulates blood pressure as well as our fluid and electrolyte balance and systemic vascular resistance. So the RAS system essentially helps to it contributes to hypertension because it actually activates the cascade that increases sympathetic outflow, which can lead to hypertension. Okay, and this system, we're going to talk about a group of medications called ACE inhibitors. And ACE inhibitors are basically angiotensin converting enzymes. And we're going to talk about those with respect to how they help to regulate blood pressure. The RAS system also helps to, as I said, it does help maintain fluid and electrolyte balance, regulates blood pressure, fluid volume, and especially with respect to sodium and potassium balance. Atrial natriuretic peptide. Atrial natriuretic peptide, its main function is to reduce expanded extracellular fluid volume by increasing renal sodium excretion. So if we can get the kidneys to get rid of sodium, water will certainly follow, because remember, sodium and water are almost like a married couple. So where the husband goes, the wife goes; where the wife goes, the husband goes. Adrenomedullin essentially acts as a vasodilator. Um, it's a vasodilatory peptide found in the body. So essentially, if it's a vasodilator, it helps widen or expand those blood vessels, which means more blood can get through with much more ease, and this should help lower blood pressure. Vasopressin, or antidiuretic hormone, on the other hand, is essentially more of a vasoconstrictor. Antidiuretic hormone, anti meaning against, diuretic, diuresis. So, against diuresis, instead of the body getting rid of fluid, that antidiuretic hormone is going to make the body hold on to fluid. So if we hold on to sodium, we're going to hold on to water. So that essentially acts more like almost like a vasoconstrictor kind of. If we're holding on to more fluid, that's going to increase blood pressure. Local factors such as inflammatory mediators also affect arterial blood pressure. Essentially, um, inflammatory mediators can cause structural changes in the resistance of blood vessels, which in turn can cause elevated blood pressure. So, some of these local inflammatory mediators, it's the cytokine production that induces these changes. Now, to a certain extent, arteriosclerosis, hardening of the arteries, and atherosclerosis, plaque accumulation, both affect arterial blood pressure. In arteriosclerosis, hardening of the arteries, it makes it much harder for blood to be received by vessels because those arteries are so hard and thick. In atherosclerosis, there's a plaque accumulation, and that plaque accumulation causes narrowing of the vessels. So think about it this way. If you were to try and drink a really thick milkshake out of a straw that was the size of like a coffee stirrer, it would be much harder to get that milkshake through that straw than it would be if you used a soda straw, or even better yet, like a really large sized Slurpee straw. So essentially, think about your vessel, or think about atherosclerosis as trying to get blood through that super narrow straw versus something that's much larger. That's what plaque does to the vessel, it narrows it. And then other factors that influence blood pressure include temperature, and sepsis plays a role in this. When people tend to be febrile, their temperature they might become more hypotensive. Dietary factors, what type of foods is the person eating? Are they eating high salty foods? So think about anything that's processed or canned or boxed. Luncheon meats, sausages, canned foods, prepackaged soups, macaroni and cheese, those types of things those dietary factors, or are they eating foods that are high in saturated fats? And then some of our risk factors include race, gender, age, weight, time of day, things like that affect blood pressure. And we'll talk about each of these a little bit more. So for right now, this is going to end this first part of the segment on hypertension and coronary artery disease. And we will pick up with the next session with session 2.